Okay. And please let me know if you're not able to see my screen. Oops. Okay, wait a second. My apologies. Technology and I are not always friends. Definitely not what I went to school for. I went to school for nursing, so therefore, um, there are sometimes some little tiny glitches, and I apologize. Okay, let me get this correct. Why is this? Oh, there we go. Just when you think you have it perfect. There. Okay. Hopefully everyone can see my screen okay. Okay, so let's get started. If you have any questions throughout the presentation, please feel free to stop and interrupt. I have no problem with it, making this as interactive as possible. And I have apparently lost. Hold on one more moment, just 1 second. Should work. Okay. All right, one more try. Oops. Technology. Okay. Can you see my screen okay? Hopefully. Okay. There we go. All righty. So a very quick introduction on myself. My name is Laura Kibbe. I am a registered nurse. I've gone through the ranks and worked in a couple different areas and whatnot within the medical field. I started actually in dietary, working as a dietary assistant, then worked as a nurse aide for a few years, and then went to school. I started with an associate's degree. I also worked as an LVN as an interim to getting my RN. I have worked in under med surg, orthopedics, rehab. I've done some pediatric home health, some hospice managed care. Um, and currently here with Parkland Community Health Plan as a clinical quality investigator, but I also enjoy teaching, which is what I received my master's degree in. I am not a OB/maternity nurse, but I am the mother of 4, and I have a grandson. And I am from the North, but when I say the North, I'm a Yankee, but I'm from upstate New York. So we have pretty foliage and waterfalls and things like that. Okay. So we've got 3 little sections we're going to cover. So we're going to talk a little bit about weight management before a person gets pregnant, and then during pregnancy, and then postpartum. Okay. And again, if you have any questions as we go along, please do not hesitate to interrupt me and ask questions. Okay. So, and if you notice when I'm talking about pre-pregnancy planning, I've got both men and women written down because needless to say, it takes both in order to have a baby. So you want to make sure that it's being planned. And as we all know, pregnancy is not always planned. It's sometimes, it's in the corner of our mind, perhaps. Timing is never 100% what we expect, but if you anticipate that at some point you want to have a child, you and your significant other, then, you can start planning as soon as you start even thinking that thought. Okay. It's real important on a couple of things that you get some family history, not just mom's family history, but you want dad's family history too. You want to know what kind of chronic and or genetic conditions run in the family. Is the family prone to heart problems, which could also include things like high blood pressure or strokes? Is there diabetes in the family? Does someone have a lot of respiratory problems? Has there been some genetic conditions, things with like Down syndrome? And then, there's a plethora of other things that could come up with as far as the genetic conditions, but you want to be prepared. They can do genetic testing once you become pregnant to determine if there is anything. I've got friends that had a child that did have some genetic disorders, and they were able to prepare for her delivery because they had that information beforehand. And of course, now any children within the family, they look at that before they, plan on, having their own children. Okay. So as far as mom goes, the mother goes, you definitely want to get in touch with your healthcare provider sooner rather than later. If you start thinking about pregnancy, the sooner you get seen by a physician, you look at your own current medical conditions. You make sure you've got any vaccinations that may be needed or required. Look at mental health. Is there, and this kind of goes with the family history a little bit too, is there any depression or anxiety or anything like that in the family history or even yourself? And it's very, very important that you be open and honest with your healthcare provider about that. A lot of people tend to get antsy when they discuss mental health conditions, or, if a person, and this goes for mom and dad, with feeling a little bit down and things like that. You want to have that out in the open because that's something that you can proactively work on and treat and be prepared for. Because especially with the mom, we know there's going to be hormonal imbalances and changes and all kinds of goofy things going on with the body. So you want to make sure, in part of your pre-planning phase and things, that you look at mental health. Okay, so you want to also look at some preventative things about avoiding diseases such as sexually transmitted diseases. Mom's going to want to start on possibly some folic acid. Again, we're going to talk to our healthcare provider on that before we automatically start that. The reason to kind of maybe get a little of that started, especially if you're in the definite, in 6 months from now, you want to talk to the doctor. Well, when should I start something like prenatal vitamins or the folic acid, which is vitamin B? And what the vitamin B does, is it helps with birth defects. So it's not necessarily something you have to start like, pre though some doctors may say, it's not going to hurt to have a tiny bit of extra vitamin B in there, because then your body also has a chance to get used to it, and you can make sure that you tolerate the extra vitamin B without any side effects, because as a general rule of thumb, there's not any problems. But in the medical profession, we've kind of learned we tend to not say never, always, and things like that, because there's always an exception. So it never hurts to try it just a little bit beforehand. The prenatal vitamins are just, if you're already on a multivitamin, the prenatals are just like an extra little boost. So you can probably just continue on regular multivitamins. But again, talk to your healthcare provider about that, because you and your healthcare provider are the ones that are going to work through all this, because the pregnancy is for at least 9 months, and postpartum, of course, is after that. Diseases you want to watch out. Oh, I was talking about the birth defects that the vitamin B help protect the baby against are things like spina bifida, which is the malformation of the spinal cord. So anything we can do to get our bodies ready to keep our baby safe is always a good thing. Some of the diseases also on both sides, mom and dad, we want to make sure you're healthy. Has there been any exposure to HIV? And even the common things that are common cycles, such as flu and strep and things like that. You want to make sure you're staying healthy, because having a cold, even a simple little cold when you're expecting, is not comfortable for you or for baby. So you want to be careful about toxic substances. Sorry. And by toxic substances, we mean things like, of course, what people always think of: chemicals, metals, fertilizers, and things. But also you want to be very careful of things like bug spray and cat or rodent feces. So if you're a person that has house pets, such as a cat or a mouse or a guinea pig or hamster or something like that, you have to be very, very careful about being around them, because they can affect during your pregnancy. You want to look out for workplace hazards and problems and exposures that there might be within the workplace. Even, working in a hospital, there's hazards, there's chemicals around and things like that. So you want to make sure you're looking for that. Violence. You want to make sure you're in a safe environment. So that's why I say it includes men and women. You want to make sure that you're both on the same path, that there's no safety concerns within the home, because you want to deal with all that first before welcoming a baby in. And then, of course, you want healthier living by avoiding things like alcohol, drugs, and smoking. And when I say drugs, I am including marijuana. I know there's a lot of, ifs, ands, whatabouts, legalization with the marijuana and things like that. Of course, in the state of Texas, it's still not legal, except for possibly for medical conditions. But it does affect females. There's kind of still a little debate on the full effect of a female, but you figure it's an artificial substance like smoking. So if you're not going to smoke a cigarette, why would you want to smoke anything else? With men, it has definitely been shown. So this is why men are also included in the planning phase. That if they smoke marijuana, it is definitely known to decrease sperm count, decrease the production of sperm, decrease the mortality of sperm, like how they're able to wiggle around. And, you think about what a sperm has to go through to make a woman pregnant. Okay, so it's always encouraged. Any artificial substances, things that we know aren't good for us, we don't want to have those. Okay. Any questions? Again, if you have any questions, please make sure to let me know. Okay, so let's get into the weight part of the pre-pregnancy. Okay, a lot of it is common sense. A lot of it people already know about, but just to kind of reinforce or go back over it again, a lot of things that are considered with weight and weight management are your BMI, which is your body mass index, which is determined by your height and your weight. And you'll see I've got the chart there showing what is considered by the CDC to be the current guidelines for your BMI. So anything over 25 is considered overweight. And this is based on the BMI. And then anything over 30 is obesity. And you'd be very surprised how little it takes to be considered obese. Okay. When you are overweight, there's can be difficulty with your fertility. You know, people that tend to be overweight or obese have more difficulties getting pregnant. My mother tried for years, and when she finally lost weight, she finally was able to have a child. So you want to make sure that you're working, especially if you're wanting to get pregnant, you're working with your healthcare provider to see, what kind of supplements you can take, what kind of suggestions they can make, and things like that, prior to getting pregnant. Because the healthier you are before you get pregnant, the better you are afterwards. Okay. So just a real quick calculating your BMI, and this is for adults over the age of 20. It's geared towards adults. It's not geared towards children, though I know there's obesity concerns and things in children, but the BMI is basically for adults over the age of 20. Now, the manual way to calculate it is you take your weight in pounds. You can also do kilograms and centimeters, but I'm one of the old school people and still use pound and inches. So you would take your weight in pounds and your height in inches and square that, divide your weight by the height squared, multiply it by 703, and then you've got your BMI. Or you can go on the internet, put in BMI calculator, and there's all kinds of different calculators out there that you pick. You put your height in, you put your weight in, and the computer does it all for you. So there are definitely some pluses to technology. Okay. So some things to consider pre-pregnancy, some recommendations, some some minor suggestions and tips. Okay, know your pre-pregnancy weight. Okay, make sure you know how much you weigh before you get pregnant, because then you're going to know and be able to figure out, how you're doing while you're pregnant with weight gain. We'll get into that in a moment. Okay, know your caloric intake and your caloric needs. Pardon me, and by that I mean kind of find out how many calories you need to survive during a day. Okay, some of us need more than others. If you're a very active person or a person with a very high metabolism, then you may require 2,000 calories, which is kind of a lot, but not for someone who is real active and, like I said, have a real high metabolism, because you want to maintain your weight or kind of lose maybe a little bit of weight, but you don't want to overdo it. Okay. Or if you happen to have a slower metabolism, you're less active, then you may need a little fewer calories, more like, 1,500 calories a day. Okay. So work with your healthcare provider to help get that good balance of what you need to do well throughout the day and maintain, feeling well and doing well and things like that. Limit added sugars and solid fats. Okay, so some example for sugars, which I'm sure everyone is well aware of, is things like candy and soft drinks and things like molasses and syrups and jams and jellies. So you want to be really careful about overdoing it with the sugars. Another thing which people don't think about or consider is fruit juices. Be very careful. Read labels. Okay, learn how to read labels. Talk to your healthcare provider, a nutritionist, a dietitian, to help you learn how to read labels, so that you're not missing something and not seeing some of those hidden sugars that sometimes can be in something that we think is good for us, and then come to find out they're so high in sugar. It's always much better to eat an apple than drink apple juice, for example. There's a little more sugar in the apple juice than there is in an actual apple. Okay. Some solid fats that we want to try to avoid, and these are the ones that are high in high saturated trans fats and things. So like butter made with milk fat, whole milk, try to drink 2% or skim milk. Ice cream. I know that's a killer for a lot of us, especially during the summertime. Um, but there are some that have some reduced fat in them, and if you do things in moderation, you might be able to sneak a little bit now and again. Things like mayonnaise, beef fat, chicken, all the fat that's around meat. Chicken fat, which is in the skin. So yeah, I love the fried chicken with the crunchy skin, but yeah, now on the crunchy skin. Pork fat, which is like lard and bacon. Let's see what else. Stick margarine and shortening. There's some alternatives to that. Make sure you're trimming your meat. You may want to leave a little, of the fat on because it helps when it's cooking to make it moist, but make sure any excess, especially after cooking, that you trim away and don't eat. And again, like with the chicken, as I mentioned, take the skin off, do the boneless, breastless, or boneless, skinless chicken. Use light mayonnaise or margarine or light mayonnaise. That'll help a little bit. And of course, you cook with coconut oil. It's kind of one of those hidden things if you're wanting to fry. I mean, you still want to try to stay away from fried foods, but if you really need to fry, yes, coconut oil does still have fat in it, but let's go ahead and try to do away with some of that. Okay. Let's see. So, okay, so pregnancy. We're going to talk about some pregnancy weight management and things like that now. Okay, so the importance of weight management while you're pregnant. Okay, there's a number one rule. When you are pregnant, do not start dieting. Okay, that's not the time to start dieting. Now, you don't want to, add on too many extra pounds when you're pregnant, but we don't really want to cut back on too much because your body's used to certain amounts of calories and certain amount of things. And baby's going to take what baby needs. So we want to make sure both you and baby stay nice and healthy. Okay. So too little weight gain, you can have a small baby. The baby can have difficulty breastfeeding, latching on and things like that. There's an increased risk of illness, not just for baby, but also for you. If you're not staying well nourished, then you're not going to be able to fight off some of the little bugs that may go around, because over a 9-month period, we have all kinds of different seasons and we have all different kinds of little normal bugs and illnesses that go around. And you can cause some developmental delays for your child. So if the baby's born too small, they could be a little bit slow, with some of the things that they may need. So you want to make sure that you're not, gaining too little weight, because like I said, the baby can have problems. But we also don't want to go to the other extreme and gain too much weight, because then we're going to have a big baby, which could come up with some, other issues and problems because they're kind of big. I mean, some people can deliver a normal, healthy 9-pound baby, but I don't think most of us want to. And if we cannot have a cesarean section, then we would prefer not to have a cesarean or C-section. Okay. Most important thing is mom and baby are perfect and fine after the delivery. But if we can do things that are better for baby and mom, a normal vaginal delivery is the best thing. Mom, you get up faster, you move around faster. Baby does all the things that it's supposed to do, does a little coughing and little yelling and stuff with the vaginal deliveries, and does, usually does better. The child is prone to childhood obesity. Okay. And then the more you gain, the more you have to lose after delivery. Okay. So just to go over a little bit too, and again, we want to make sure we have a healthcare provider helping us through all of this. Okay. There were some national numbers out, and this is per the March of Dimes, excuse me, where there are 20.4% of the pregnant women in Texas get inadequate prenatal care. Okay, so nationwide, that it's only 14.9%, which is still higher than we would like it to be. But Texas is, 6% higher than that. So we really want to encourage everyone to get prenatal care, which is part of the reason. Go to the doctor before you get pregnant. So then while you're pregnant, you get that care that you need. Okay. So an average weight gain for, everything goes as planned and as anticipated and worked on and all that good stuff, is 25 to 35 pounds. Okay, that's the average. And you're going to gain different amounts during different trimesters. Usually the first trimester, it's only 2 to 4 pounds for the full trimester, maybe a little bit more. And then you get like a pound per week for the remaining trimesters, especially in the third. Okay. Overweight women, however, though, should gain a little bit less than that, like 15 to 25 pounds, depending on what the pre-pregnancy weight is. Okay. If you're underweight, you're going to possibly gain more weight while you're pregnant, because you're going to need to, if you started out underweight, meaning you should have probably been just a little bit heavier, you're below those normal averages and things like that, you're going to want to gain 28 to 40 pounds, okay, during your entire pregnancy. And this is for the whole pregnancy. And then if someone's having multiple babies, twins or triplets, twins, you're going to need to gain 37 to 54 pounds throughout the whole pregnancy. Okay. So, and that's to get to term. Now, if you have more than 2 babies, chances are you will deliver a little bit earlier, but you'll still need to gain probably over 50 pounds. Okay. Let's see. So let's talk about where some of that weight gain comes from, or why there's the weight gain. Okay. So the causes of your weight gain is your little one. Okay. You're going to gain, the average is an 8-pound baby. Okay. So you're going to gain 8 pounds of that, 25 to 30 pounds is a baby. Okay. The placenta generally weighs, and let's see if I can do this. Hopefully you can see this, but the placenta is right here against the wall of the uterus. That weighs anywhere from 2 to 3 pounds. Okay, so that adds weight. So here's our baby, here's our placenta. There's 11 pounds right there throughout the pregnancy. And then, of course, there's the amniotic fluid that the baby's floating around in. So that, of course, is going to add another 2 to 3 pounds. Then breast tissue. Whether you breastfeed or not, and if you kind of look at the little diagram of the gestations of the baby going through, the first trimester, and then you've got like a couple pictures of the second trimester, and then the third, you also notice that the breast line does get larger. Well, we're getting ready to nourish our baby. Like I said, so whether you're breastfeeding or not breastfeeding, that's still going to happen, but we want that to happen. And then you do have an increase, and that'll give us another 2 to 3 pounds, believe it or not. Then we have blood supply. There's an increase in blood supply because there's an extra little thing there. So that's an extra 4 pounds. Then we have some extra fat storage because we just, for nourishing the baby, nourishing mom, keeping the body up. So the extra fat is anywhere from 5 to 9 pounds. And then the uterus itself, because it's growing and expanding, can gain up to 2 to 5 pounds. Okay, so when you add that all up, that's our 25 to 35 pounds. That's just for the baby. Okay. But that's why it's important to know like your pre-pregnancy weight, so then you know how much you're gaining and what you may or may not need to gain during your pregnancy. Okay, so some recommendations and suggestions during your pregnancy is, again, know your caloric needs. Now, this is just an average. During the first trimester, general average caloric intake is 1,800 calories. Okay, for all 3 meals and any snacks and things like that. For the second trimester, because baby's growing even more than it was, is 2,200 calories per day. And then that third trimester, when the baby is super growing, everything should be pretty much formed at the beginning of the third trimester, so we're working on everything getting stronger and the baby getting bigger, getting ready to be born, it's 2,400 calories per day. Okay, you want to keep track of your weight, which of course, while you're going to your healthcare provider, your OBGYN, or nurse midwife, or however your delivery is being anticipated and your healthcare provider is, you want to track that weight, which they will of course be assisting you with. Okay, you want to eat a balanced diet. Okay, you want to make sure that you're including your fruits and your vegetables, and you're making sure that you're getting everything that you need, including some snacks. Okay, that'll help keep your energy up. And you want to try to maintain exercise up to, or at least 150 minutes, which sounds phenomenal, but take 150 minutes over 7 days. That's just 2.5 hours. Okay, even if you just did 30 minutes Monday through Friday. Okay, moderate intensity activities such as brisk walking per week. Go out for a walk. Even if you just did 20 minutes a day, which is good for all of us. Okay, and then of course we want to also look back at what we mentioned earlier about your healthy living and avoiding fatty foods and all that good stuff, and the sugars and alcohol and smoking and whatnot. Okay, so the reason we do this is we want to have a nice, happy, healthy baby, and then we have to worry about our postpartum weight and weight management. Okay, so we have our beautiful little baby, healthy and happy and all that wonderful stuff. So we want to look at how much weight did we gain. Okay, we know we're only supposed to hopefully gain the 25 to 35 pounds. We know realistically that doesn't always happen. Okay, so we have baby be delivered and we check our weight again. Okay, we work with our healthcare provider to help us to get our weight back down, and do not plan or anticipate losing the weight really fast. Okay, when you can breastfeed, if you're able to do that. If you cannot, I am not here to preach on, oh yay, breastfeed. Yes, there are some definite benefits for breastfeeding, and one of the benefits for breastfeeding is it does tend to help moms lose some weight. It will not necessarily help you lose all the weight that you need to lose, but it will help you lose some of it. And of course, it is a little bit healthier for baby because it gives some natural nutrition and things like that. It helps with the immunization, or excuse me, immunity and things for your newborn. But it's not always possible. And some people don't want to do that, and there's absolutely nothing wrong with that. But if you're able to, it will help a little bit with your weight loss. Okay. And the most important thing though is you need to be very, very realistic on what your anticipation is, because you don't want to try to do anything without thinking about it first. Okay. So some recommendations and tips. Do not crash diet. Do not say, okay, I'm not going to eat anything. I'm going to go down to 1,000 calories a day and things like that. No, 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 no. Not healthy for you at all. And actually not good for baby. Because if you start those crash diets and you're not willing to take your time losing weight, especially if you're breastfeeding, then if you're breastfeeding, you're not going to have enough nutrition to feed baby. You're going to be exhausted because you're not getting enough calories. And that's whether you're breastfeeding or not breastfeeding. Okay, so you want to do it in moderation. You want to work with your healthcare provider, or again, a dietitian and nutritionist, to help you manage your calories well. Okay. Let's see. So we're going to monitor our calories still. And there's tons of apps out there that if you're into apps and whatnot, that can help you monitor your calories, that give you ballpark ideas. They're not perfect, because trying to enter certain foods in, you can't always do that. But I do know there's one that I've used before, that you put in Wendy's cheeseburger, and they have menus for a lot of very popular restaurants and things like that. So you're able to say, okay, well, I'm going to cheat and go McDonald's, Wendy's, Arby's, whatever your your favorite fast food places. And it's going to let you know how many calories are in those French fries that you think you wanted. Okay. Make sure to eat breakfast. We get preached that when we're growing up, eat your breakfast, start your day off right. It's very, very, very true. If you eat breakfast, it kicks off your day, it kicks off your metabolism, and it helps get things going because we want our metabolism to get functioning. Okay. If we skip a meal, it's going to decrease our metabolism, which isn't going to burn off the calories we want it to burn off. It'll burn off good calories before it burns off the fat and things. Okay, and don't skip meals, especially new moms. Skipping meals, you're going to get more worn out, like I mentioned before, with doing the crash diet. So you do not want to skip meals, and if you can, eat 5 to 6 meals, or eat your 3 meals with some healthy snacks in between. Okay, make your healthy choices, healthy snacks, nuts, some vegetables, some granola, yogurt. Be conscious of what you're doing because, again, we want to limit or avoid things like sugar and refined carbs and highly processed foods like McDonald's and Arby's and things like that. Okay. So we want to try to eat things that are a little healthier for us. Like with the carbs, if we're trying to kind of watch our carbs, do whole grain cereals or brown rice, things like that. Low fat diet, dairy. So if you're eating yogurt, kind of watch some of the yogurts because some of them are really, really good, but can be a little higher in fat and sugar than we really want. So there are some, positive choices out there for things like that. Fiber, you may want to increase your fiber intake just a little tiny bit to keep everything going regular. People don't like to talk about this, but we don't want to get constipated. Okay. First couple of weeks, we may not be moving as briskly or fastly as we were prior to being pregnant and having our baby. So things can slow down. We don't want to have things slow down. So increase your fiber intake a little bit. And you can do that just with simple things like pears and berries. Some people, bananas work well to keep things going. Nuts, artichoke hearts are good for fiber. Okay, and we want to try to do as much naturally with foods versus taking, medications. Okay, so let's try really hard to stick with food items. And I'm going to give you another suggestion in a minute when we get down towards the bottom a little bit more. Broil, bake, or steam food instead of frying. Actually, you'd be amazed at some of the extra flavors you have when you do that with your food. But if you need a little bit more flavor, try doing, and since you've now already had your baby, a little bit of spice, but be very, very careful if you're breastfeeding. Because remember, whatever you eat, baby gets. And every once in a while, if you eat something that's a gassy vegetable, say like cauliflower and broccoli, can be a little gassy, you will notice that your baby might be. So that may be something, as healthy as it is for us when we're breastfeeding, sometimes we have to change our diet pattern just a little bit so that we don't upset baby's tummy too. Okay. Let's see. Slow down. Focus on eating, not on anything else. People have a horrible habit of, watching TV and things like that when they're eating. Focus on what you're eating. Take your time. We tend to eat a little less when we're focusing what's there. Do portion control. Like I said, small meals. So, get your plate and just put nice portions on, not heaping portions. And especially if you're doing the snacks in between, the healthy snacks in between, you'll find that you don't need quite as much when you sit for breakfast, lunch, or dinner if you're doing a little more portion control and you're having those healthy snacks, like I said. And again, it's 5 to 6 meals. So you have your 3 meals, breakfast, lunch, and dinner. You have your snack between breakfast and lunch, a little snack between lunch and dinner, and then a little snack before you go to bed, but not too late because you want to be able to rest well. And if we tend to eat too much before we go to bed, we don't sleep as well, because sleep is very, very important. You want to make sure you're getting enough sleep while you can, because if you're too worn out, you're going to barely have enough energy for baby, let alone going for a walk or doing something like that. And the walking is great and things, moving around with baby, depending on the weather, because we can go for a walk with our baby, and we're both getting exercise, and we're both getting fresh air, and we're teaching our baby how to stay healthy right from the very, very beginning. Let's see, seek support and help. There's plenty of groups for new moms. Again, healthcare provider, dietitian, nutritionist. You can talk some with trainers and things like that, but you know, that's totally up to you. Talk to your friends, talk to your family, talk to other people that have had a baby and say, oh, I'm exhausted. What kind of things did you do to help you sleep and things like that? One of the things that is really good and can be sort of helpful, especially with meal suggestions and things like that, excuse me, is called myplate.gov, and it's myplate.gov. Okay, government website, so it's a good site and resource to use. But it can help you. You can put in, meal planning postpartum, meal planning while pregnant, even. And it gives you some really good healthy choices and suggestions, and can be very, very helpful. There are some other sites, and this one's also used by a lot of people, or recommended by people like with diabetes and things like that. So that's why I kind of like that one a little bit. Let's see. And again, keep your goals realistic. Okay. You carried a child for 9 months. It did some wonderful things for your body, sort of. It gave you a new life, gave you a beautiful baby to take care of. So give your body a break, excuse me. Okay. And let's see. Oops, too far. There we go. So, make some good choices. If you have some extra pregnancy weight, you do want to try to lose that little bit, because if you're going to have another child, you don't want to, already have that weight on before you have another child. Okay. So that'll help that risk. If you stay with increased weight, of course, like with any other thing, whether you've had a child or not, and you are overweight or obese, you've of course increased your chances for diabetes and heart disease and things like that. So let's see what else. Oh, and also with the possible future pregnancies, this also will increase your risk of gestational diabetes, even if you didn't have it with your first pregnancy. If you've got some extra weight on you and you have an additional pregnancy or pregnancies, you increase your risk with the extra weight with each pregnancy for gestational diabetes, which then, of course, at times can lead to type 2 diabetes. Okay, so we want to make sure that we get that taken care of right away and try to lose it as soon as possible. Over time, not quickly. Okay. So if you have any questions or need any additional assistance or need additional information, feel free to reach out to me. That is my work number and my email. You also, if you are a member of Parkland Community Health Plan, please feel free to reach out to your STAR member or CHIP member, customer service numbers that are there. Okay, and they can assist you or direct you. There are some programs if you are pregnant, some additional case management assistance and guidance throughout your pregnancy to help you with all the different things that go on with that. Okay, and they can also offer you some additional suggestions and information. Are there any questions? And again, like I said, if you don't feel like getting online, especially because we are recording this, I know some people are a little more hesitant when something's being recorded to speak out. Please, again, feel free to email me and contact member services. Okay. And then there's the resources and things that I used. And again, I apologize for the delay and the technical difficulty, but I do appreciate you watching, and I hope you have a wonderful day. And I will stop sharing my screen just to make sure that I did not miss any questions. Okay, thank you very much and have a wonderful day.